Now, there are growing calls for a more coordinated approach in London's public health services to deal with the growth of drug addiction and related sexually transmitted infections. A recent report by the British Medical Journal suggests the rise of so-called Chemsex could also be behind the increase in HIV cases here in the capital. A warning, there are adult themes in Paul Hawkins' report.
A small but growing number of gay men are taking drugs specifically to enhance their sexual experience.
I'm coming to your house tonight.
This is a trailer from a Vice News film about chemsex released this week.
You come into London to find your gay life and you find Grindr. And within perhaps 4 conversations, you're going to be introduced to chems.
And by chems, we're talking about GHB, crystal meth and mephedrone, which when combined with alcohol can ruin lives.
Well, the first time I did it was enjoyable, but it just took me to very dark places.
John used to be hooked on chemsex parties.
It's quite scary, you know, because you get to a place that you just don't care about yourself.
And what was it that was addictive? Was it the sex? Was it the drugs? Was it both?
The combination of both things, you know, it's just becoming unmanageable, an addiction that you just cannot control. I don't really remember because of the blackouts. You know, sometimes I just went into this kind of limbo that you just don't remember.
Over a 2-year period, he lost 15 kilos in weight and visited A&E 4 times after chemsex parties.
I thought to myself, is this what you want for your life? I said to myself, no, it's not. I want to live.
John contracted STIs, but it could have been worse. In the capital, 5 gay men are diagnosed with HIV every day. London's been called the European capital for chemsex. A recent report published in the British Medical Journal suggests it could be pushing up HIV rates in the capital. It suggests making chemsex a public health priority, and it says there should be more specialist clinics. Until that happens, clinics like this continue to develop specialist services. Hannah McCall is a sexual health expert who wrote the report.
So what we wanted to find out was who is doing chemsex, what sort of drugs are they using, and what are the dangers involved with that. Making sure that doctors and nurses working in the NHS know what chemsex is, know the sorts of people that might be doing chemsex, know how to look after those people or what services to refer them to.
Public Health England says joined-up services are important to deal with what they call risky behaviour. They've set up a working group of experts to calculate how many people are affected and develop new guidance. The chemsex conversation has started, but what's needed now is action, not words. Paul Hawkins, BBC London News.